I'm Andy Rosenberg. I'm chair of the Department of Anesthesiology, Perioperative Care, and Pain Medicine at the NYU Langone Medical Center. So I chose anesthesiology as a specialty because it really encompassed two of the really exciting areas of medicine to me. First, as a cerebral internal medicine component, because in the operating room you have to do a lot of thinking, but also as an anesthesiologist, it's a very procedure-oriented specialty. So in the operating room, you're working with the colleagues who are physicians and you're interacting a lot, but at the same time, you're doing a lot of procedures and you're thinking about the physiology and the pharmacology of the patient. And also at the same time, what you have to do is you have to react very, very quickly to the changes in any of the blood pressure, heart rate, or any of the physiological components that are involved in the patient. Most of my career has been spent in the field of orthopedic anesthesia, and in that area we've been very active in regional anesthesia techniques so that the patient who's come into the operating room does not necessarily have to get a general anesthetic. Ultrasound-guided regional anesthesia has become very popular, and we use that a lot in the operating room so we can numb up a patient and the surgeon can operate on an arm or the lower extremity without a problem. We've been very important and influential throughout the country in educating other anesthesiologists on regional anesthetic techniques, and have actually built some simulators that anesthesiologists utilize to learn on so they can practice on those so they can use them on patients. One of the great things about anesthesiology is that early on we chose the area of patient safety as a focus, and the Anesthesia Patient Safety Foundation has promulgated the concept that we really have to take excellent care of patients. The Institute of Medicine, in its report, when it started to look at safety as an issue, actually was able to note that the anesthesiology community had been very important in safety. And I think that is when patients are coming into the operating room at NYU, they should really understand that we are trying to use the safest techniques and take the best care possible of them. I think the most gratifying thing about being a doctor is that at the end of the day, you can say to yourself, I've helped somebody had a problem, we've taken them to the hospital and we've done the best we can, and they are better off for that. And being here at NYU Langone lets you know that you have a leg up on doing that because you're starting out working in coordination with personnel who are really excellent at that.